I love teaching psychology courses because I think psychology is really the study of why we are the way that we are. And there's so many different theories and aspects that you can look at in trying to explain human behavior. And I've always just been really fascinated personally with just why people act the way that they do. And one of the things that I try to emphasize to my students is that hopefully this class is of interest to you, because hopefully this helps you to better understand yourself, understand the people in your environment, kind of understand the world around you and how your behavior has kind of been shaped in a certain way. So I like psychology because it's really the study of us. Placebo effect. And a lot of people are familiar with the placebo effect. Essentially when pharmaceutical companies are doing drug trials, they'll get groups of people and they'll split them into two groups, and they'll give one group the actual medication that they're testing, and they'll give the other group what they call a placebo pill. Basically, it's a pill that has nothing in it pharmacologically that'll really help you with whatever issue it is that you're being treated for. And what we find out in most studies is that those people that are getting the medication, if the medication is effective, their problem will improve, their situation will improve. But the people that are getting the pill that has just sugar in it will also improve. And it's really, really interesting that even when people know that they're getting a placebo pill, it can still be effective. So there was a study that was done a couple of years ago with patients who had lower back pain. And they were being treated for their lower back pain, and they took this group of patients and they split them up into two groups. And they told one group to continue to take their medications as prescribed, and they told the other group to take this pill. And they were told that it was a placebo pill, but they were also told that based on previous research, if people thought that the pill could be helpful, it showed some benefit. So they told them up front, there's absolutely nothing in this that will help you with your problem, and yet it still might help you with your problem. So they're telling them right up front that it's a placebo. And what they found, the results of the study were, when they compared the people who continued treatment as usual and the people who were given this placebo and told that it was a placebo, the people that received the placebo had a 30% reduction in lower back pain and a significant improvement in their everyday functionality as compared to the control group that was receiving treatment as usual and really experienced no kind of difference in their functionality or their pain level. Now, a lot of people would look at that and they would say, well, you know, it goes to show you that it's all in your mind. And I think it's something much more significant than that. Typically, when we think of the interaction between our behavior and our neurology, we think that brain chemicals make us act the way that we do. And I think what this study really shows is the power of the mind and the power of our ability to think about a certain situation or a certain problem and manifest a different reality.